Jayapal is the co-chair of the Congressional Progressive Caucus, a nearly 100-member strong body in the House of Representatives. And I am also thrilled to be joined here tonight by Sue Wilmot. Sue Wilmot is a leader in UFCW Local 21. She has been employed in the grocery industry for 40 years and over 20 years on Bainbridge Island, which is opposite Seattle. Sue tells me I'm from the middle of the country, Indiana, so I'm learning my geography. So wonderful to be here with the Congresswoman from Seattle and with Sue Wilmot from UFCW Local 21. So we really are holding these Facebook Live discussions to help folks across the country who are really struggling and suffering know what it is that progressives are fighting for, to help us understand what folks on the ground are experiencing, and to learn from people who are leading by example. And so, Sue, I was hoping to open it up with you and ask you some questions about what you're experiencing as a cashier and as a leader in UFCW Local 21. And if you could tell us a little bit about what it's like right now to be working in a grocery store and providing that essential service. And first, let me just start by saying thank you on behalf of everyone on this call.
Well, thank you too, and thanks for giving a voice to us grocery workers. I have been a grocery checker for almost 40 years, and I just want to say that none of us signed up for this, but here we are. And I am so proud of my fellow grocery workers and our solidarity of purpose. We are, right now, our focus is to keep each other safe and keep our community safe. And I'm sorry, it's just a little emotional. I
know, so
you know, the virus started out here, that, you know, Seattle area. And, you know, just going along, we didn't expect how it's progressed, and kind of flying by the seat of our pants as we do stuff. At first, we were completely overwhelmed with the shopping. You know, we were prepared. We prepared for this. We've done this before. Whenever there's a storm, a snowstorm, the crush of people coming in and supplying. This went on for 2.5 weeks straight of triple, quadruple the business, and we were just overwhelmed, didn't have enough help, couldn't keep things clean. And our union listened to us and figured out what we needed and negotiated with our employers, and we're doing a lot better now. We've got our feet under us. We're a well-oiled machine. We've got the cleaning system down. We've got shortened hours. We've negotiated a lot of things with our employers to help keep us safe. And we're doing a lot better now. So we're feeling less like sacrifices and more like contributors, first responders.
Yeah, I'm so glad to hear that. And of course, the work that you're doing is essential frontline work. You're keeping people fed across the country throughout this terrible crisis we're facing. And I know it means making real sacrifices, going to work every day and standing as a cashier and seeing folks who are coming through who may indeed be carrying novel coronavirus. And so I know there are other challenges that folks are facing whose kids' schools are shut down and who might find it hard to go to work. Are those some of the things that you all are facing? Are you, where are you guys in terms of the personal protective equipment that folks
we run out of stuff as well. We just negotiated yesterday the ability to wear masks on the job, so we can protect ourselves as long as we provide our own masks.
Wow.
We ran out of gloves at work. A construction person here on the island brought us boxes of gloves so that we got resupplied with those. We ran out of paper towels. We were, with our Starbucks kiosk, using towels and microfiber, and they have like a whole sanitation system, doing the Starbucks sanitation system in our tech station. We have negotiated hazard pay. We're getting an extra $2 an hour right now. We have negotiated an extra 2 weeks of paid leave if we have to be quarantined or if we have the virus, so people don't have to worry and also that we are able to keep our health insurance as well. We are working with our union to hire more people. In 3 days, we got over 20 people hired just in 3 days to help us with sanitation and keeping. We have limited number of hours. We used to be open more hours a day. We've shortened it so we have time to restock and time to sanitize. We are giving workers a lot more flexibility in their schedules to accommodate childcare, and so that if it's a childcare reason that they can't get there, that they're not disciplined for it. We do in this state, in Washington State, we have paid family medical leave, and we do have paid sick leave that we have statewide. So we do have that to back us up as well, which our union helped to pass here too. We are, just still asking for more things that we need. We would love to be considered for as first responders, so we get that access to having a test to see if we have the virus, if to be first in line to get those tests, because we're exposed to so many people. So one thing that I personally did was I flat out refused to do something that was against CDC regulations, and it was unsafe, and I just refused to do it. And because I have the union at my back, I was able to make something safer in my store. So just having that focus of safety with our union at our backs is great.
Sue, thank you so much to you and to UFCW Local 21 and UFCW nationwide for working to protect our folks in grocery stores and retail and so many other sectors. I think the examples that you're giving really help us understand why it's so important that we support making sure that folks can form a union, because unions are the ones who do look out for workplace safety. Unions are the ones who are there to know when there are problems on the job and are there to have folks' backs. And just hearing what you're telling us, Sue, right now, and about the things you've been able to negotiate, I'm so thrilled to hear it. And I hope that more folks across the country will be able to do that. And of course, as we work our way toward a recovery that really puts people first, a big part of that has to be supporting and collective bargaining and organizing, so that we can actually support people throughout the economy and making a living and staying safe and healthy. So thank you, Sue, for all you do. And I just want to tell you that right now, coming in on the chat, we're seeing just a lot of love and a lot of appreciation for you, Sue. So really, we can't say it enough. You are the front lines, and where would the rest of us be without you all? So thank you. And Congresswoman, I want to turn to you now and ask you to tell us a little bit about what it is like in Seattle right now. You all were absolutely among the first hit and among the hardest hit with novel coronavirus. And I know that you have been working 24/7 to meet folks' needs and to develop solutions at the scale of the crisis. And I'd like to just start by asking you, how are you doing, and how are folks doing in Seattle?
Thanks, Liz, and thanks to you and the CPC Center for doing these and for all the work you did. You were absolutely invaluable in helping us to quickly analyze what was in the bill and get that information out to our Progressive Caucus members and actually to the whole caucus. So we are deeply grateful. And I just have to start by saying how proud I am to have UFCW 21 here in the district, and Sue, for your incredible leadership on the board. And really what 21 did is immediately jumped in to say, hey, we need respect as workers. And I really think that a lot of what they've negotiated here is a lesson for some of the other industries, whether it's bus drivers or hotel workers, who are now, some of whom will be called back here in Seattle because we did finally get our field emergency hospital here from FEMA. And so that is going to be up and running in 2 days. That means we're going to have 350 troops deployed here to staff that medical hospital. They're not armed or anything. They're all about providing full capacity in the hospital But that means they're going to be staying in some of our area hotels. And I think that there are many of our frontline workers that we don't think about as frontline workers. The bus drivers I mentioned, you know, they are helping folks with disabilities get on the buses, and they are not able to maintain that social distancing. So there's a whole group of workers who are not public health workers, who are not in the hospitals, but are actually providing these emergency services that we need to have everything continue to go. And so I think that's a great model. In terms of what we're experiencing, Liz, it's been devastating. We were, you know, the first case in the country was diagnosed here in Snohomish County, which is just north of Seattle. I represent a piece of that. And then, of course, the Kirkland nursing home, where all of the initial deaths started happening, is just next to my district and just outside of Seattle. Now, Washington State, I haven't gotten today's numbers. I get updates every single day, but yesterday's numbers were that we were at almost 4,900 positive cases. And we are now at, as of yesterday, we were at 195 deaths. We are increasing, unfortunately, the numbers of deaths are increasing dramatically, and the number of cases is increasing dramatically. We expect that the surge, we haven't hit the high point of this surge yet. It's going to be in the next 2 to 3 weeks. And until then, we will see doubling and tripling sometimes of the numbers that we've seen. So this is a real crisis here in Washington State. And because the cases were found first here, and because we have a great governor and great public, you know, city council members, mayor, King County executives, state legislators, we did take slowdown measures early, which meant that we did, you know, implement some restrictions, which also meant that our economy has been suffering for much longer. So if you think about the fact that some places are only just shutting things down, which may not be smart for them, and then you think about the fact that we've had over you know, we've had really over a month now of shut down economic activity. Our workers are really struggling. So our hospital systems are overwhelmed. It is really tough, but there is incredible resilience in the community. The workers like Sue and UFCW 21, but also people who are raising money for artists, for undocumented immigrants, because we were at the forefront of the fight for 15 and paid leave, as Sue said. We had some protections in place, but we also had a progressive movement that immediately mobilized to get city officials and our state officials to declare things like moratoriums on evictions and foreclosures, assistance for small businesses before the federal government could even respond. So in that sense, I guess I feel fortunate that we live in such a compassionate, resilient, and progressive state, but we're hurting, and many people around the country are.
Mm-hmm. My heart goes out to you and your team, and to all the folks in the state of Washington who are suffering, and across the country who are joining us here on this call. And that really brings me to a question for you, Congresswoman, about the relief that you're leading the charge on in Washington. And you really have been a voice calling for relief that is going to ensure that there's testing and treatment for every single person who needs it, that there's personal protective equipment for all our frontline workers, and making sure that we do our very best to bring about the kind of economic relief measures that can stop the pain and suffering just as quickly as possible, and do it for everyone. So I want to say thank you for that incredible work, and the progressive movement really stands with you, and we're so grateful for your leadership and for the nearly 100 members of the Progressive Caucus who've stood with you, and what a difference that has made. So I was hoping you could tell folks on this call a little bit about where we are, about the relief package that passed on Friday, about the progressive measures that you fought to get into that package, and about what you see as the next steps here, and what's left to be done.
Yeah, thanks, Liz. On behalf of our nearly 100 Progressive Caucus members and my co-chair, Mark Pocan of Wisconsin, and working with you and with the movement of think tanks and groups across the country, we were able to put forward to Speaker Pelosi a unified list of progressive priorities, 12 progressive priorities for the third relief package that we just passed. And, I will just say, first of all, two challenges. One is that we are in divided government. And so what we wanted and what you saw reflected to a large degree in the Democratic bill that was introduced is not what the final bill was. The bill is not perfect. We did not get a lot of things that we wanted in there. And there are some things in there that we really, really don't like and need to try and fix. The second challenge is that in a crisis of this scale, the response has to be enormous. And so while $2.3 trillion sounds like a lot, and that's on top of two other bills that we've passed that were of lesser amounts, it is really not sufficient to address the scale. And we are utilizing the systems that we already have in place, the unemployment system, the IRS system, other things like that, to try to get relief out to people quickly. But we have to recognize that those systems are still a patchwork themselves. They don't cover everybody, but they are quicker at getting money out than it would be to design new programs. So those are the two challenges I wanted to mention. But what is in the bill is significant, and it is significant relief for people across the country. First, for individuals, the bill includes a critical priority for all of us. That was the largest expansion of unemployment insurance in decades to ensure that workers get nearly 100% of their pre-layoff wage, and without some of the traditional restrictions like waiting a week for your money to kick in. It also creates a special program to provide relief to those who may be ineligible for regular unemployment benefits, like gig workers and people who are self-employed. It also includes a big priority for all of us was direct payments, cash payments to people to get money in their pockets. Now, the Progressive Caucus was advocating for $2,000 per adult plus $1,000 per child. That would be a monthly payment for up to 6 months with a renewal of another 6 months. We did not get that. We got a one-time cash payment, which will still be significant for people, that provides $1,200 per adult and $500 per child to the vast majority of people. Again, not what we asked for, but something. In addition, to keep people in their homes, the bill provides $3 billion in rental assistance, and it also enacts a 120-day moratorium on evictions for properties that receive federal assistance, as well as a 60-day foreclosure moratorium on federally backed mortgages. We think that that should be across the board, not just for federal properties, and we also need more rental assistance directly to people. It also includes crucial funding to the Emergency Services Grant to ensure that we're providing better care to people experiencing homelessness. It also has additional funding of $900 million to help low-income people pay their energy bills. This is really critical. One of the things that Rashida Tlaib, a CPC member, has been so articulate about is that we should have put in money to help people pay their utility bills, their water bills, because, in this crisis, we're telling people to wash their hands. If your water is being shut off, you're not going to be able to do that. So those are a number of different things on the individual front. Second, for small businesses and nonprofits, we have $350 billion in forgivable loans that can also be used for payroll, rent, utilities, and other necessary costs to help small businesses weather the crisis, as well as emergency grants of $10,000. And those forgivable loans are forgivable if a small business actually rehires, keeps their payroll going. So we're trying to direct the aid towards small businesses, but also towards the workers that are powering those small businesses. Third, for our state and local and tribal governments, we have $150 billion for a state and local relief fund to provide states and localities with additional resources. We have $30 billion for states, school districts, and institutions of higher education to alleviate the challenges that educators and students and families are struggling with in light of school and childcare center closures. That does include money for those childcare centers. There's also $25 billion of money for transit agencies. And while typically that money from transportation, federal transportation authorities is not for operating expenses, this is actually for operating expenses. It's to keep those local transit agencies going through the course of this crisis. And then we have $8 billion for tribal governments and ensuring parity in access to other crucial programs to help Native American communities across the country. And there's also $400 million for states to help prepare for the 2020 elections. Way, way, way too little. This is a critical issue. It's got to be a priority in our next bill. Finally, for our healthcare system, there's $200 billion for hospitals, health systems, and health research, including expanding funding for personal protective equipment through the emergency stockpile, and ensuring things like ventilators and N95 masks. So those are a lot of the pieces that are in the bill. You know, I think in terms of what I'm most distressed about that's in the bill, it's a couple of things. One, that the industry assistance, a $500 fund for Steve Mnuchin basically to control, just does not have enough accountability around it. There are some measures that have a congressional oversight panel and inspector general, but really we needed to be conditioning all of this aid so that it goes directly to workers, and so there is real authority for us to make sure that that aid is not just used by, you know, corporations for whatever they want. Pete DeFazio, who is the chair of Transportation and Infrastructure, one of the co-founders of the Congressional Progressive Caucus, did do a really good job in trying to get some of those provisions into the airline package. And so the airline assistance does have some real conditions where the majority of the money is directed towards payroll and benefits. And there are restrictions around not being able to use it for stock buybacks, not being able to use it for CEO pay, things like that, that are very important, not being able to use it for dividends. But that does not apply across the rest of the funds. And so that is a real problem. And we've got to do something to bring that accountability in. Second thing is that there are too many people that are excluded. And I want to focus for a minute on many, many types of immigrants that are excluded from all of these benefits. It is a very narrow definition for a qualified resident to get some of these benefits. And so for example, on the cash assistance, you have to have filed taxes and not an ITIN. You have to have had a social security number to get that cash assistance. Unemployment does not apply to people who don't have work authorization. So that means that all of the undocumented immigrants who are out there picking the food that goes into the food banks and onto your grocery shelves and onto your tables are not going to get unemployment assistance. Similarly, a lot of the DACA folks who are on the front lines of helping to provide healthcare, they're not getting a lot of the assistance that is in the bill. And so that is a serious issue that we have to address. Third thing we tried to get in, we could not get in, that has to be a priority next time around, is treatment, healthcare treatment, because these expenses on top of a healthcare system that is already broken, where people can't afford the cost of medication and treatment, now we have coronavirus. So imagine if you have a family member who has just died of the virus, you could be getting a bill for their hospital treatment on top of that. And this is expensive because it's ICU beds, it's ventilators, it's the ultimate kind of treatment that you need if you have this virus. So we need to be providing free treatment. And we also need to be picking up all the people who are now unemployed. For every person that ever said to me, employer insurance offers you choice, I would say, what choice? Because all of those people are now dropped from their employer plans and do not have health insurance. We should be expanding Medicare and Medicaid to pick up those folks and get them in. And then finally, on student loans, I didn't mention that in the bill, we do have a provision in the bill that has a moratorium on student loan payments through September of 2020. And with no interest accruing, but really we should be forgiving some of these loans, a minimum of $10,000 per person in loan forgiveness to stimulate the economy at a time when people are really hitting the rocks. So those are some. There are others, of course. OSHA protections being a critical piece of this, safety protections for workers on the front line, and of course, more testing and PPE in general.
Thank you, Congresswoman, for that really clear-eyed view of what more needs to be done, and also for just sharing with folks the relief that's available now. We saw a lot of comments come in as you were talking, and people are, I think, very glad to hear that you are going to be working hard on accountability measures for the $450 billion that we know went to industry, and putting some real conditions on that. There's a lot of concern on this in this group to make sure that that happens. We're seeing folks who are asking questions about really, I think a big question everybody wants to know is, what are the prospects for getting a next relief package, right? Because we know there's a lot that needs to be in that.
Yeah. We're hard at work already on those priorities. The things I mentioned were some of them. We're still putting together a full list. We understand that the House is, the chairs are already beginning their work on that. We hope to have for the Congressional Progressive Caucus a list of priorities within the next week that we can put forward to the Speaker and to others. We hope that this bill starts in the House again, because we saw that when something starts in the Republican-controlled Senate, we are essentially arguing with Republicans who wrote the bill versus being able to put out our vision of what we know is essential. And again, I know 2.3 trillion might sound like a lot to people. It is nothing compared to the scale of this crisis. And we are seeing that every single day. So we need to get more relief into workers' hands immediately. When the unemployment insurance system starts to expand, people will see some relief right away. The stimulus checks will be important, but there's a lot we need to do, and we are at work right now. The timing, it looks like we've been told that barring some big emergency or change, we won't be back until April 21st. We have a lot of members, unfortunately, who have, a number of members who have contracted the virus, who are quarantined. There are all sorts of issues about not meeting our governor's requests to stay home. And so we are not in session technically until April 21st. That could change if there are significant, if we continue to see the surge across the country. And so we are just doing everything we can to move this as fast as we possibly can. We don't have time to waste.
Mm-hmm. I want to ask you just a couple of other questions that we're seeing from listeners and viewers here today. So Mahari asks, what are you doing to help small businesses? And I know you've told me personally how many small businesses are struggling in your district, and what relief is there for them, and how do they access it?
Yeah, so small businesses, there are a couple of forms of relief. And remember, I tell everybody to think about this pack, because people have said to me, that $1,200 stimulus check isn't enough. And by the way, I think it's a disaster relief check, not a stimulus check. But, and I say to them, listen, there's a lot of different pieces of this bill. And so I would say that to small businesses as well. But the big pieces of the bill for small businesses have to do with this $350 billion in forgivable loans. These will be distributed probably through the banking system, because that is actually quicker than going through the SBA, because there are banks in every community across the country. They will waive a lot of their traditional requirements. There won't be requirements around showing the ability to pay back or collateral or things like that. So they will be able to move much more quickly. And the idea is that you will be eligible for one of those forgivable loans. And it depends on the size of your payroll and the size of your business. And then that money can be used for payroll, benefits, rent, utilities, all the things that you need to keep your small business going. If you then are hiring back people and keeping your payroll, then you will be able to apply for loan forgiveness. Now, there are still details we're working through. Senator Cardin actually has a really good summary of the small business provisions, and we're continuing to add to that. That will be on our website, jayapal.house.gov, by the end of the evening. You may also have that, Liz, on your site. And so that is a good provision. The other one is a $10 billion emergency grant program that will allow for up to $10,000 per business. And that is just an emergency grant. And you can get that, you can apply for that along with your economic disaster loans. So that is part of that program. So there are a couple of different sources for small businesses, and we break it out in that document that I mentioned so that you can see exactly where you go to apply. And your SBA and your state will also be able to give you more information on exactly how to access that.
Thank you, Congresswoman. And Sue, we heard from you that you know, for grocery store workers, there's been even a shortage of masks and protective equipment, and that you were able to win the right to wear those in the store. We need to make sure that personal protective equipment is in the hands of every frontline worker, every healthcare worker, every person working in transportation or childcare or other frontline industries. And Congresswoman, we're hearing a lot of questions on this chat about the Defense Production Act and the ability of Congress to really get the president to do his job and make sure that personal protective equipment gets out there to our frontline responders, to our healthcare workers and ventilators to make sure that people don't die who would otherwise live with that life-saving equipment. So can you tell us a little bit about the work that you're doing on that front?
Yeah, absolutely. Well, first of all, you know, this is a product of years of disinvestment into the strategic stockpile, the National Emergency Stockpile, strategic stockpile. This administration also disbanded the pandemic relief task force that was there in order to prepare us. And so I should just say that we are not prepared for this. And I say that having just gotten off a call with our state delegation, our congressional delegation, our 2 senators and our 9 members of Congress with the with the FEMA administrator, Pete Gaynor, and his team. And this was one of the biggest frustrations. We don't have enough. We don't have enough masks. We don't have enough gowns. We don't have enough gloves. We don't have enough test kits. We don't have enough ventilators. I mean, this is a massive problem. The Admiral, I forget his name, from the Joint Chiefs, who used to handle logistics for the Joint Chiefs, has now moved over into FEMA. And he gave probably the most comprehensive overview of what they are doing, but I'm telling you, it's late. So they are trying to essentially get supply from all over the world. They're trying to find all the sourcers of supplies all over the world. But remember, this is a global crisis. So we're competing with people all over the world. But they're trying to get as much as they can from elsewhere. They're trying to then source from here. And he agreed that we need to utilize the Defense Production Act, which, for those people who don't know, it allows the president the power to direct manufacturing capability here in the United States to increase the supply of all of these critically needed things that we have, or that we don't have but need to have. And so that is the step that the president has invoked the Defense Production Act, but he has not utilized it to actually direct private sector manufacturers to change their manufacturing lines so that they can actually get those lines adapted in whatever way possible to manufacturing those things. So they have started to do that with some of the manufacturers locally, according to the Admiral, domestically, just the ones that are already producing those things, trying to help them ramp up capacity. But now the next step is to make sure that we are actually increasing supply here domestically by directing manufacturers who may, like GM, there's a partnership between GM and Ventec, which is here in Washington State, to produce more ventilators. This is possible. We can put those production lines to work, obviously adapted to make some of the things here in the United States. Long term, Liz, we should be producing this stuff in the United States. There's no reason we can't have production of these things in the United States so that we're not entirely dependent on China or some other country to send us swabs or pipettes or ventilators or masks or gowns or gloves. That's absurd. We can do it here in the United States. We should build that capacity in for the long term.
Absolutely. Congresswoman, we know our seniors are really suffering. Folks are being told to please stay home, to avoid going to the grocery store, and they have additional costs right now to get groceries and other things delivered. What are some things that Congress can do for our seniors in order to make sure that they're able to weather this crisis?
Well, the first thing is increase the Social Security benefits. I mean, this is the time that we should be doing this. And, you know, let's be as generous as possible. I mean, it should be no less than $200 a month, but we should be thinking about more than that, because we are asking seniors to stay home, which means they have additional costs for grocery delivery. It means they have additional costs for transport to their medical appointments if they need to go, because they probably can't use public transit. They probably got to use, you know, some sort of a car service. There are all kinds of additional costs that they are accruing right now, not to mention that, you know, many of them are so anxious because of their retirement funds and the market going down. And so what I keep hearing from my seniors is, I don't know how I'm going to live if I don't have this money coming in that is guaranteed through my Social Security income. In addition to that, you know, we've been saying for a long time, we need to have cost of living adjustments to Social Security payments. And we need to do that now, because to get something here in Seattle, in the Seattle area, is quite a bit more expensive, particularly with some of the increases for the cost of many of these supplies, these groceries. So, and then of course on healthcare, you know, we need to expand the healthcare benefits for seniors, because there is no reason that they should be getting charged an arm and a leg for things that aren't currently covered under Medicare, or the payments they have to make under Medicare Advantage. We should be fixing those.
Thank you, Congresswoman, and thank you so much for standing up for our seniors. Sue, I want to ask you, when you hear about the work that the Congresswoman is leading in Washington State and in Washington, D.C., and you have your ear to the ground on what your members are facing, what are some of the things that you really hope to see from our leaders in Washington?
Well, I would like them to see what we've done here, and instead of having us have to fight with our employers, to make it so that those employers have to comply without a fight, especially for the non-union workers as well, because they're out there too. One of my other concerns is for the farm workers in the country too. They're working in very close conditions, living in close conditions. A lot of them are undocumented, and they don't have the protections that we do. And they're right there sending the food to our stores. And I'm very concerned about our food supply going down the line too. So we need to protect those farm workers as well. And they need protections that we have. Just to learn from what we've done here really quickly and share information, what's working, and implement it, and make people not have to fight to wear a mask at work.
That seems just so sensible. And we know that we all pay the price when we treat people badly. And that's what we've done for too many years in this country, is we've disinvested in people. And we're seeing right now that we need to treat every single person like they matter, because they do. And that is how we stop the spread of this pandemic and how we stop it in its tracks. And I'm so grateful for the work that you're leading, Sue, on behalf of folks at UFCW Local 21. And I do think it's an example for folks across the country of what we can do when we all pull together. And Congresswoman, thank you for the work that you're leading in Washington State. And for the work that you're leading in Washington, D.C. There's a lot of work ahead, as we all know, and we in the progressive movement stand shoulder to shoulder with both of you, and we thank you for your leadership.
Liz, thank you so much. Thank you so much for your leadership. And if I can just say to everybody, you know, I know we're talking about social distancing, but I like to think about it as physical distancing and social closening. Let's remember we are deeply interconnected. And in order to take care of each other, we have to stay home and we have to follow all the public health guidelines, but we also have to fight for each other. And we have to fight for each other with a tremendous amount of love and gratitude for each of the roles that every single person in our communities, in our neighborhoods, and in our society plays. And so I just want to say to everybody that's out there, we see you, we are standing with you, we will get relief to you, and we send you love and justice.
Thank you. And we are so lucky to have you fighting for us. So thanks to all of our folks on Facebook for joining us on this call. Thank you for all that you do each and every day. And please, folks out there, stay safe, call your loved ones, and keep on fighting. Bye-bye.